We're going to go ahead and call the Health Committee meeting to order at 1:03. Councilman Thornton, could you lead us in prayer, sir?
Dear Heavenly Father, thank you for this beautiful day. Thank you for letting us sit here on this council and help our people, help our employees and our administration, Justice Department. But more so, thank you for the council being able to help our people in different ways. Please, Lord, be with our service people that are in harm's way. Be with our veterans that need help every day, that is fought overseas in the wars. In Jesus Christ's name I pray. Amen.
Amen. All right, Shelley, roll call.
Yes, sir. Frankie Hargis. Brian Warner.
Ani.
Bill Anglin. Keith Austin.
Here.
Jack Baker.
Here.
Harley Buzzard. Joe Bird.
Ani.
Sean Crittenden.
Ani.
Don Garvin. Wanda Hatfield. Rex Jordan.
Here.
Dick Lay.
Ani.
Curtis Snouts.
Here.
Janice Taylor. Here. David Thornton.
Ani.
Victoria Vasquez. David Walkingstick. And you do have a form.
At this time, I'd like to ask for a motion for approval of the minutes.
Motion so made.
Got a second. All in favor?
Aye.
All right, moving on down to reports. Claremore Service Units, Mr. George.
Good afternoon. I think you have my report there in your pack. Well, I had a couple of things I was going to. We've been upgrading our dental electronic health record, trying to get it up to speed with our medical side. They're actually different. But that's been upgraded. Buying some new equipment for optometry. Just bought a new visual field machine. Our pharmacy received accreditation for the postgraduate year one residency program from ASHP. So quite an accomplishment there for them. Program for our pediatric clinic, one of our nurses signed us up. It's a Taco Bell certificate of bravery. Small kids that come through and go to the dock. They get to go down to Taco Bell. I thought that was kind of a new program there, and I thought that was quite ingenious. We are in the process of implementing a new safety policy. It's called Stop the Line. It came from Toyota, where it empowers any employee in the hospital, regardless of their rank or GS level or where they work, that they can stop whatever's going on if they see anything unsafe there in the hospital and bring it to our attention. We're really trying to promote safety of the patients and the staff there. So we're real excited about that. Any questions?
Any questions for George? Counselor Austin.
Not so much a question, more a statement. This past 2 weeks ago, I called George on a Sunday afternoon on his cell phone in his free time because I had a constituent who had some service issues that week at Claremore Indian. And I will say that they were taken care of, and that patient was taken care of very, very well. And George is willing to answer his phone at Sunday afternoon on his free time. and he didn't have my cell phone number, so it wasn't because a council person was calling. But he took the call. He served with a smile. He took care of that patient, and that patient has responded very well to treatment now and is doing very, very well. But I appreciate that very much.
Oh, no problem.
Anyone else? Counselor Buzzard?
George, do we have any idea on the orthopedic clinic that's going to Oklahoma City when we might get that resolved with negotiations and get one?
I talked to the CEO over at Hillcrest Claremore just last week, and he said it's setting, that he keeps calling their legal department, it's setting in their legal department. He's waiting, he's as anxious as I am to get it out and get it started.
Wow.
I get with them I call them every week to see where that is. Yes, sir, I'll continue to push.
All right. Okay.
Anyone else? All right, good report. Thank you, George. Appreciate you.
Thank you.
Next up, Cherokee Nation Health Services, Miss Connie Davis.
Good afternoon. Seems like we just met. Thank you to Jeff Sanders for loaning me his glasses. I left mine in the car in our frantic rush to grab some lunch and get back in time for this. So this meeting, or this report will be brief. We'll just highlight our productivity for the month of March. And as you look at the trend, we continue to creep up in our visits. It's a good thing. Hastings at 38,000 patient visits for the month of March. Wilma P. Mankiller, 10,837. Redbird Smith, 11,746. Salina, 8,668. J, 8,431. Nowata, 5,316. Muskogee, 17,465. I think that's the biggest number I've seen in Muskogee, and possibly in Nowata. That's a big jump. Oshaleta, 4,601. Bonita, 10,477. And then the Argadoogie Employee Health Clinic at 379. So the following page shows a total of 116,269 patients served in the month of March. The trend continues in both our pharmacy services and our dental services. You'll see on page 5, 8,500. That was a pretty difficult number just to round off, but 8,500. We set historical records in the dental clinic every month with the patients seen. We also set a record number of surgical procedures performed at Hastings, 446. If you think about the report we heard at 10:30, what it would be like if that number was 900. Just putting that out there. Left without being seen rate, you met Dr. Katie Hughes in the earlier meeting. This girl is dynamite down there. Her and Dr. Smallwood, they are rocking it out. Our left without being seen rate was 4%, yet the visits in the ER continue to go up. So she's doing a tremendous job. Our revenue is slowly creeping up to where we really want to be on target for the month of March, 22 million. And I got another cash report this morning. We get them every Monday, and the trend's continuing to hold about 2.6 million a week. So if we can just hold that level, we'll be able to meet our budget for this year. We're really happy about that. The other thing I really want to draw to your attention is the contract health money. The more patients we see, the more contract health dollars we're going to spend. And so just making you aware that we're working to control our spending there. We did meet and revise our contract health policies and procedures to clarify the elective cases. And if you guys want a copy of those, go through a FOIA, and we'd be happy to share those with you. But we met and spent a whole afternoon going over those, and I think you'll be happy to see what the end-work product is. And I think the other thing, in light of the recent news, is the cyber attacks that has having an impact on a lot of health institutions and their electronic health record. I don't know if you guys have seen that on the news, but Donnie Parrish was on top of that on Friday afternoon, sending out emails And he worked throughout the weekend because I had received several emails over the weekend. So I've asked him to come and kind of give you guys an update on what we're doing to protect our medical records and reassure you so you can reassure your constituents in the event that you're asked. So if you're all right with that, I'll have Donnie come up and speak to that.
Sure.
Good afternoon. As Ms. Davis said, in the recent news, there was a global cyber attack across the globe with a ransomware. Ransomware is a malicious software where people try to take control of your computer or gain access to certain files. This ransomware encrypted files, and it was specifically targeted at healthcare organizations in over 100 countries. When it encrypts the file, it then sends you a message saying you can get your files back if you pay this amount. The amount was about $300, or you can pay with a digital currency called Bitcoin. It's been very vindictive in spreading across the place. It really affected the UK and their healthcare system. I was very proud of our response. The Cherokee Nation as a whole has reacted very well, working with all of our vendors, working with Cerner, making sure things are locked down as they should be. We feel pretty good at this point. The teams worked throughout the weekend, and it's not an uncommon occurrence where we spend a lot of time working on security, and I'm glad there's some awareness about it, because this is, in healthcare especially, trying to protect our patient data and protect our citizens' data is very important to us. So, is there any questions?
Anybody? I've got a question. Do we do any type of training as far as employees and things that you guys send out? Like, for example, at Carl Albert, we contract with what's called Know Before, and I didn't know if we do that same thing. You know, we all sit down. I recently did my IT security training and stuff, and man, it was really, really informative about ways to look through and to hover before you click to see if that matches certain things. I didn't know if we do anything like that.
We do, and we do contract with certain companies like Know Before. Ms. Davis, actually working with me a few years ago, implemented the first security team in Cherokee Nation. So part of that was a security and awareness program.
Right.
Sending out education. It's mainly by email. You know, there's always a chance to improve.
Right. Well, and it's one of those things. A lot of our employees came to me. I don't understand why we have to do this, you know. And then now it's on the news of all this, and now they're coming back saying, "Boy, I really am appreciative that you guys did this." So.
In
That's a good
healthcare,
thing.
probably the greatest struggle that we have is you want it to be secure, but you still have to maintain usability for our providers, and having those discussions and
Yep.
creating that understanding.
Does anybody have any questions?
Just a comment. So each executive director is given the email to get, and instructions that this virus is out there, and they're instructed on how to handle each department?
All employee email did
Yeah.
go out as well, yes.
Okay.
And for the most part, we'd like you just to contact the help desk and your IT teams to be able to respond.
Okay.
And we did send out, because again, a threat would be personal computers. Now, a lot of us access personal computers and personal data from non-Cherokee Nation-owned devices. So part of that information was how to protect your personal computers as well.
Do we work with other tribes that may not have the capacity to handle a crisis like that, like we?
I think that's a great question. You know, in the past, we've had maybe some more formal organizations. We ourselves work with everybody from the FBI, Department of Homeland Defense, Department of Homeland Security, excuse me, IHS specifically, with some of the other tribes. But those seem to be our focus points.
Thank you, Mr. Chairman.
And intertribal, excuse me.
Any questions for Connie? Councilman Buzzard.
Donnie, I'm glad you came by. Jack Kennedy, the IT there. I understand that's still one of the parts of how fast we should be getting some. I've had some problems, I've seen some problems. This gal was on there and just went blank and he loses everything, has to go back and reboot. And it sits there and spin and spin and spin and spin. Well, I understand that's kind of a up-to-date system up there, but it's still not working like it's up to date. What are we doing about it?
We are trying to address some of the slowdowns.
Oh, you are?
Yes, sir, yes. You know, our network speeds across the 14 counties, we are rural, and we do
Yeah,
have,
yeah.
you know, that's our number one issue with a lot of the, especially with the EHR, when you have slowdowns. And then as software gets updated, you have compatibility issues, and we address those, you know, case by case.
Are we still, do we have those T1 lines running from Telecaster J anymore?
We got rid of those. We actually have released a RFP for a new network
Okay.
that would interconnect all of health at very fast speeds.
Okay. Well, I know I talked to some of the employees up there, and they said they get frustrated when they're trying to enter some of that stuff on it and get kicked out, so.
Oh, yes, sir.
Anyway, well, I'm glad to hear you're working on the thing.
Thank you.
Thank you. Thanks, sir.
Council Taylor.
I had sent you an email after the, Todd was in here talking about the opiate case that we have brought. And I had some questions about I understand doctors are supposed to be inputting into a database anytime they prescribe opioids. And I want to have 100% assurity that our doctors are doing that.
I can assure you that is the expectation, that they should be doing that.
Okay. Is there any type of repercussion for, not just within our system, but with doctors, if they are caught not entering that into the system? Is it a suggestion or is it a requirement that they do that?
I'm going to say that it is an expectation, and then defer the rest of that to Dr. Starr.
In Oklahoma, it is a requirement, and the way our system is structured is it is automatically sent to that database when the provider issues the prescription, because it's all done electronically.
That's part of
So
it
it's
at the time.
it's all but impossible not to submit to the registration.
For Cherokee Nation doctors or for?
For Cherokee Nation.
Okay.
For Cherokee.
Okay, you can't speak to others. I have another question, so you might want to stay up. Is there any standard? I have talked to different people who said, and within and without Cherokee Nation, okay, they had minor surgery, they got one Lortab, and the doctor said, if you need another one, come back tomorrow, we'll take care of that. Somebody else had a tooth pulled, got 42 of them, and went home. Is there any, you know, like the Medicare rates, you know, if you have an ingrown toenail addressed, you get 2. If you have this or that, is there any within the healthcare, not just us, but is there any standard for what is acceptable, what is reasonable?
So, ma'am, that's a wonderful question, and I will say that right now, there is absolutely no standard, and it is at the discretion of the provider, such that standards are developed by juries and plaintiffs' attorneys only when there are bad outcomes.
Okay.
But one person's idea of compassionate treatment of pain may be another provider's concept of irresponsible prescribing, and that is one of the most difficult issues facing our country.
Well, now that as a physician, you have the issue of some people have a high pain tolerance, some people have a low pain tolerance. But it seems to me like there ought to be, you know, like 7 ought to be reasonable to get them started at least.
So I'll say this, one of the issues that comes up, Tylenol number 3 is a good example. There's 97 different genetic variants within the human body of how codeine is metabolized. And because of the way that medications affect different people, for one person, you know, 100 tablets of codeine might not be enough because it's not metabolized. For another person, 5 might be too many. So this is one of the things that complicates it.
Okay, all right, thank you.
Thank
That's all I
you.
have.
Councilor Lake.
Thank you, Mr. Chair. Ms. Davis, for the new elective procedures you just mentioned, we have to FOIA to see what those are.
It's not a list of specific procedures. I can give you a copy of that and explain it better, but these are considered elective, in a general term speaking, elective are procedures that are not life-threatening or compromising a limb. And that's a very short explanation. We want to cover fractures, you know, things like that.
I just, when you say it, would council or patients, either one, have to FOIA for that information, I think that sounds like you've gone over the hill on me.
No, sir.
That's just a comment.
No, but since we revised the entire policy for contract health, they had not been updated since, some of them back to 2001. We went through and did an update with everything so that we were very current in our practice.
So all of your policy guidelines have been updated?
Yes, sir.
Do we have copies of those?
We can get you copies of those.
Well, those should be at the clinics now, if you've had time to do them.
They are not at the clinics yet.
They will be.
These are practices that have been implemented. A lot of those policies were still pertinent to today.
Sure.
It was a matter of changing, we don't call contract health anymore. It's PRC or PCR.
Purchase referred care.
Thank you. I still call it contract health so everyone understands. Minor things like that. Getting rid of Bartlesville in there and making it Oshaleta, minor tweaks like that.
Sure. Okay. So those are available, will be available to the clinics and to the patients.
Mr. Hayes told me they were done, right?
I see a thumbs up back there. Does that mean yes, Brett? And so, but I still have to FOIA for this new elective procedures guideline?
That's my understanding of the process to obtain those types of things. It's not like trying to keep a secret. I'm just trying to comply with the law and.
Well, I mean, that's the question. So, okay, I'll deal with that later. I've gotten some calls from Claremore, and I guess we have staff doing behavioral health.
Yes, sir.
People can't use the phone to get in. Are we short a clerk or a answering person at that clinic or at that hospital?
We would have to be in executive session in
Okay.
order for me to answer that. It's an HR issue.
That's okay, thank you. And that's it, thank you.
Thank you. Anyone else? Any other questions for Connie? All right, good report. Connie, we really appreciate you guys coming down and visiting earlier. It was very, very informal, so thank you.
We appreciate your support.
All right, moving down to old business, none pending. New business, same, none pending. Any announcements? Yeah, next meeting tentatively scheduled for Monday, June 19th at 1 p.m. I'll take a motion. And have a second?
Second.
All in favor?
Aye.
All right, we are adjourned.
We're the only ones that.